It's time for female facial sculpting, and this is one of the things that my younger patients always complain about, dark circles. This happens even in your 20s. A lot of patients start to lose volume in their middle face and the under eyes become a little darker, a little more hollow. So come take a look at my beautiful client. She doesn't really have much of an issue, but when you look at her under certain lighting, she's noticing those tear troughs starting to form, and she really wants a little bit of facial contouring. So what we're gonna do is we're gonna elevate the deep medial fat pads of her cheek to give support to the under eye. We're gonna apply a little bit of filler to the eye and to the chin to give her some facial sculpting, and she's gonna look slender and she's gonna look more youthful. Look on up for me a second. So we're gonna start by using a little bit of a more robust filler that's gonna have some volume to the mid part of the face. This is Voluma. You guys know this is our standard sort of mid-face lifting filler. The reason we choose this as one of our go-tos in this area is because it lasts a longer period of time. The Vicross technology tends to last longer in this area than in other areas. So you can get up to 2 years of longevity. Although when you're thin like her, or you're in LA and you work out a lot, that doesn't last as long. You metabolize the filler a little bit more quickly. So she's gonna look a little bit bigger at first, but we're only doing like a half a syringe, very little. You guys will see that contour is starting to form. See that little bit of edge right there of the cheek? Switch. So that gives a nice little support there. Just hold. Yeah. And so we're gonna do that same thing here. You see her cheek fat pad, she has more of an angle downward, so we need to elevate that.
What is used for dark under eyes?
This is what we're doing right now. When did you come in? When did you join? So we are doing this right now for under eye hollows and for a little bit of dark circle. We're using the Voluma to elevate the area, and we're gonna use a little bit of Restylane for her under eye and for her chin. And I like this filler because it's a little softer. The one thing about Voluma is you don't want to overdo the amount of it. It's a lot harder to reverse if you don't like it, and it's a little bit, it can become a little bit of a clump if you overdo the amount in the area.
How much for this procedure? We're going to say that depends on the syringe and how many you're doing. It depends on if you're going to film with us too. That can determine some things.
And also, yeah, the package that we put together. So if you take a look now, look at the angles of the cheek there. That very small amount of filler made a huge difference.
Do you want to know, does this hurt? Can our patient tell us? How do you feel?
Very, very, very soft and gentle.
And you guys see the angles here? So their angles are high. It's a little bit of a different angle than you're used to seeing where it comes back a little bit more laterally. She has a longer face, so you want to enhance it by lifting it laterally. So now we're going to start with the chin just a little bit. This area hurts a teeny bit more because we're right on bone. What we want to do is bring that chin forward. How do we do that? Well, some females, you want to widen the chin. In this one, we're going to project the chin and bring it more to a point. You can see it coming out already. I'm going to do more of a triangular approach and give it more projection. Show them from the side angle, Jordan, because I want them to see as it projects, the difference it really makes on the chin itself can be very dramatic. And it's going to be pretty dramatic on her. This is only one syringe. Take a look at that. Look at that. Look from the side. Pan that. Nose, lip, chin ratio is now in proportion, which gives her face a slenderized look and a little bit of an improvement in her jawline and her neck just from improving the chin. What do you guys think?
That's good.
It was really good.
Good, right? So now we're going to go to the eye. In this area here, I want to do a couple things. One is I want to focus on giving a little support here. This is just some swelling that she has here that will go down. We're going to do a little bit to the trough itself, a very small amount of Restylane. This is kind of going back to old school. Restylane tends to be one of the first fillers that people used for under eye improvement. And I want to give a little support to the edge of her fold because that's going to give a lift here that's going to push to the under eye. Then we're going to work our way up. Just 2 injection points, very small, 1, 2, to give her some support and a little massage, and that's all she needs. Let's go to the other side. Again, a little swelling here, you can see where that is. That's going to settle down. And the next day or two. But again, we're gonna go a little bit more superficial with our injection. And some people, 1, 2, some people will bleed a little bit more. If you're a wine drinker, you got a little more bleeding. So you guys can see already. Open your eyes and look all the way up for me. So you want to take a look at the under eye hollows. We're just going to go, now that she's open, we can take a little bit of look and go a little bit more into the trough for her. Perfect. Just got to be careful. It also allows me to see the vein. You see the vein right here? That vein comes right out of the orbital fossa that's there. So I can actually follow the vein and make sure that I don't hit it. We don't need anything fancy like those infrared vein finders if you know the anatomy. All right, so we finished. She did a really good job. What time is it?
It's time to pass her the phone.
And what are we gonna do?
We're gonna let her put herself in for the Emer reveal.
We're gonna do an Emer reveal right now.
You ready?
So we're gonna give you the phone. We're gonna give her the phone. Go ahead and take it.
Alright, here we go.
And you're gonna take a look at yourself.
Here, grab the phone.
Take a look.
Ooh.
What do you think?
Love.
What were you looking for?
Everything you just did.
In
Wow.
total. So what do you notice? What do you see?
Well, I'm definitely a lot fuller here, not so
Right.
hollow. A little bit still numb.
What do you think of the chin? Come look up close. Look at the chin. Turn to the side.
Finally smooth. Ooh,
Look up a little bit. What do you think?
very defined.
Very defined. It's brought forward. It makes the neck a little bit tighter, and to give you more definition in the cheek, fold, and eyes. See, it's not about just the one area, you guys. It's about contouring the face is three-dimensional. We call it dimensional contouring or lifting. So we not only supported the eye by lifting the fold and the fat pad by elevating the cheek. This whole area is working together in conjunction to get a better improvement. The fold, the under eye, and the cheek together. I think the chin just makes it.
Wow.
What do you think?
I mean, not to be, I feel great.
No, what were you gonna say? What were you gonna say?
I mean, I think I look good.
How about I look good?
Yeah.
Okay, so now
I'm
switch it
good.
to the mirror, switch it to the mirror. So we're gonna flip it back. Now we're gonna show you it in the mirror so you can get a different perspective, because it looks a little bit different on, what do you think now?
Wow. And this is a little swollen.
Yeah, it's
This
gonna
is
go
gonna
down.
go down. Wow.
But the angles are there.
It's, everything is nice and smooth.
Yeah, that's what we want, smooth transition between the cheek and under eye, and I always tell people, the under eye area, you wanna do very slow. So we did half a syringe aside. If you need a little bit more, you do that in 2 to 4 weeks from now when the swelling goes down. Once that settles, you know the total amount needed in a year, but you don't wanna overdo it, that's enough for that area. Chin is perfect, that one syringe made it, and the cheek is perfect, half and half. So that's female facial sculpting. She can't stop looking at herself. Hand her, show everybody what we did, and we'll see you guys soon.
Great.
We'll keep your chin up though, that show it off. Good?
Never had my cameras
So
on.
we're gonna clean you, he's gonna take the pictures. You wanna do studio 2 for immediate?